Hello, my name is Becca. I'm going to be your nurse. Can
Hi.
you tell me your name
My name is Mathis.
and your birthday?
It's July 26th, 1996.
Thank you. And where are you?
I am in my bedroom.
And who is our president?
Donald Trump.
Okay, thank you. We'll test your cranial nerves first. Cranial nerve 1. What do you smell?
It's like vanilla.
Perfect. Cranial nerve 2 was the eye test we did before with the Snellen chart.
Yeah.
Cranial nerves 3, 4, and 6. We'll test your eyes here. So raise your eyebrows for me. Perfect. And then I'm going to test your eyes. So just look right at me. I'm going to shine this light to test your pupils. Thank you. And now I'm going to have you follow your eyes with my pen, but try not to move your head. Thank you. Perfect. And then I am going to have you follow, once again, just look straight at my pen. Perfect. And then I'm going to test the red light reflex. So what I'm going to have you do is look at my shoulder, but I'm going to shine the light in. I don't have the right tool, so it doesn't exactly show me, but that's what I would do. Thank you. Now we're going to cranial nerves 5 and 7 and have you blow your cheeks out. Thank you. I'm going to have you smile, frown, open your mouth wide, and then close your mouth and clench your teeth. Does that hurt there?
No.
Okay, and then I'll have you scrunch your face together like that. Perfect. And then I'm going to have you close your eyes. I'm going to drag an object across your skin. Tell me if it feels sharp or dull.
Sharp. Dull. Sharp. Dull. Dull. Sharp.
Perfect. Thank you. Okay, cranial nerve 8. This is my pretend tuning fork. You would tell me if you can hear the sound equally on both sides.
Mm-hmm.
And then I would test the conduction versus air sound, and you would tell me which one you could hear more. I'll just simulate it here. He would tell me, same thing, other side. Perfect. Thank you so much. Cranial nerves 9, 10, and 12. I'm going to have you stick your tongue out, wiggle it around a little bit, touch your nose. Perfect. And then you're going to touch your tongue to the inside of your cheek and kind of push it out a little bit. Yep, just like that. Perfect. Thank you. And then I'm going to have you open your mouth with my pretend tongue depressor. Say, ah. Perfect. And then I'm going to test your gag reflex. Hope you gag. Won't really. And then I'll have you test your swallowing too. Perfect. Thank you. Okay, so that was 9, 10, and 12. Now we'll do cranial nerve 11. Can you shrug your shoulders for me? Perfect. I'm going to set my hand on the side of your head, and I'm going to have you push your head against my hand. Good. Other side. Good. And then I am going to have you close your eyes. I'm going to put an object in your hand and tell me what you feel.
Well, that's a pen.
A pen. Perfect. Thank you. With your eyes closed, tell me what you feel here.
It's a smiley face.
Smiley face that I drew. Perfect. Now I'm going to have you stand up, and I'm going to have you close your eyes, stick your arms out. To the side. I'm so sorry. Stick your arms to the side. Perfect. And then lift one foot off the ground, and then lift the other foot off the ground. Wonderful. And then put your arms down with your eyes closed. Stay there for a moment. Thank you. And now you can open your eyes. What I'm going to have you do next is lift your foot and touch your toe to your shin, the opposite shin, and drag it down. Kind of show with the camera here. Okay, and then the other side, please. Just like that. And while you stand there, we're going to test your rapid alternating movements. So you're going to lift your hands up kind of in front of you, and then I'm going to have you twist them back and forth. Just like that. Perfect. And then with each finger, touch your thumb. Perfect. Okay, that looks good. And then now I'm going to have you can put your hands down. Thank you. I'm going to have you walk. I'm just going to hold the camera so you can see. I'm going to have you walk one way on your tippy toes and then come back on your heels. Okay, oops, come back on your heels. Okay, thank you. We'll have you sit down. Continue on here. Those were our cranial nerves. I'm just going to move on with the assessment. I'm going to check your head. Check in your hair, feels good. I'm going to check your skin that I can see, skin on your hands and on your legs, looks good. I'm going to check inside your ears. Do you have any pain or discomfort in your ears?
No.
Okay, I'm gonna check your other ear. Thank you so much. Any pain when I press here or here?
No.
Okay. I'm gonna check in your nose. So I'm gonna use my light, thank you. And then, do you have any trouble breathing?
No.
Okay. Press one finger to each nostril and breathe in. So breathe in like that. And then the other side. Was it pretty equal in breathing?
Yeah.
Okay. I'm gonna have you open your mouth and stick your tongue out again so I can check your tonsils and your membranes. Looks good. And I'm gonna just feel your lymph nodes along your throat and kind of down here, that lymphatic system. Using those little motions there, good. I'm gonna turn your neck to the side, assess your jugular vein and your other side. I'm gonna feel your carotid pulse at the same time I feel your radial pulse. Good, I'm gonna switch sides here. Thank you, hopefully you saw that, looks good. I'm also gonna listen to your carotid pulses. If you can just, thank you. And I would do the other side here. Thank you. This looks good. I'm gonna feel your thyroid here, gently. And then I'm gonna have you swallow. Thank you. Okay, looks good. I'm gonna listen to your heart here. So I'd start here at the aortic position. We would go pulmonary position, herbs position, tricuspid position, mitral position for the heart. You'd also just listen normally here for a full minute. I won't do it here, but I would. Perfect. I'm gonna listen to your lung sounds. If you can take a couple deep breaths in, I'm gonna do the front and then I'll do the back. So deep breath in, and then we go down to the lower lobe. Good, and then the back here, I would do all lobes on the back. Sorry, you can't really see. Good. There's a few more tests I'll have you do while I listen with my stethoscope. So I'll have you say E and kind of hold it while I listen to each part.
E.
Good. And now I'm going to have you whisper 1, 2, 3 while I move in each spot. Okay, so just kind of whisper. 1, 2, 3. 1, 2, 3. 1, 2, 3. Good. Okay, and then I'm going to have you say 99.
99. 99. 99. 99.
Good. And then I'm going to have you say 99 again while I feel here.
99.
Perfect. Okay, that looks good. I'm going to feel your pulses one more time and check your capillary refill on your hands here. I would just do that by pressing. Okay, let's have you lay down, if that's okay.
Mm-hmm.
Okay. Try to get as much as possible of you. Move the camera a little bit, sorry. Okay, so while you're laying down, I am going to assess your bowels, your liver, your spleen, and then check your legs, things like that. So first with your abdomen here, I'm gonna press lightly at first, palpate. Any pain or discomfort?
No.
Okay, I'll go deeper now. Any problems?
No.
Okay, and then last I would percuss, so kind of tap here. Anything?
No.
Okay, so I'm gonna have you take a deep breath in. I'm gonna feel this liver area. Ready? Deep breath in. Good. That was a little bit light. I'm gonna do it one more time deeper. Okay, and then I'm gonna percuss there. No issues with the liver. Okay, same for the spleen, kind of softly, and then was that okay?
Yeah.
Okay, a little bit deeper. Nothing?
Nothing.
Okay, percuss.
Yeah.
It's good there?
That's good.
Okay, I'm gonna listen to your bowel sounds in all 4 quadrants. And then I am gonna listen to your aorta. It's just right here in the middle, okay? Good. Okay, so I'm gonna feel your pulses. Back to the radial pulse. Good. And then I would do the popliteal pulses right over here. And then I'm just gonna move this so you can actually see what I'm doing a little bit. Okay, and then I'm gonna feel the pedal pulses right here. Good, checking for any edema. Don't have any edema. I am going to have you put your legs kind of together and then flex your foot like this and push against my hands. Good. And then same thing. Now push against my hands here. No clonus there. Good. Okay. Can I have you sit up for me? Last thing here, I will check your reflexes. I'm going to have you lift your arm up. I know this isn't really going to test it, but this is what I would do. Tests there. And then I have you kind of bend your arm like that and test right here. And then I would test here on both sides. So I'm going to lift your arm up again, kind of test there, test there, and then test right here. And then I would test the patellar tendon, reflex here. And then I would test his Achilles. Can you just lift your foot up so they can see? I would test right here, the back of the leg, this one too. Okay. Any questions?
No.
Thanks.
Thank you.